Today we are going to discuss grief and bereavement, and with me I have Dr. Lakshmi, who is a clinical psychologist at Mediclinic Deira and Tawar Dialysis Center. Good to have you with us.
Thank you for this invite. Yeah.
Can you please tell us about grief and bereavement and what's the difference between the two?
Yeah, so grief and bereavement, they are always used inconsistently and always sometimes used interchangeably in terms of literature. And people also confuse these two topics as they feel that it's the same.
Okay.
But the fact is, grief is a kind of process where you have cognitive symptoms, emotional symptoms, behavioral symptoms, which results in functional disability in a person after a person has lost someone in their life, or it can be even in terms of if he loses his identity, loses his financial status, or it can be any loss which is considered as a part of grief. But in terms of bereavement, we can understand that it is a fact or it's a part of your grieving. So it is something like just a term, or the fact of losing is called as the bereavement.
Okay, so could you tell us about the stages of normal grief?
So there are 5 stages of grief. We can understand that the person goes through a stage of denial or shock, and then we have a stage of anger. The person has a hard time in understanding that such a loss has happened in his life, and then you can see that the person moves through a stage of bargaining or negotiation. So then there is a stage of depression when the person doesn't, or he loses his functional aspects to his life. He becomes like totally impaired in his way of functioning. And then you can see that the stage of acceptance, where there is an integration of the death. There is an integration that the person has, he understands that he has lost that one person from his life, and it is more accepted in the last stage of grief.
So my understanding is that people experience grief differently. What are the factors that influence their expression of grief?
Okay, so as we know that some of them, they have very difficult time period to accept that how this loss has happened, which can vary upon their personality factors. It can vary about in terms of their attachment with that deceased person. So again, the attachment can be something which depends on how, in what age you are in how was your relationship with that person. That means which is about the closeness of the bonding, and also when you were, in what stage of your life are you with that particular person. So everything is something which the attachment is related to. Also about the nature of the death. Is it about something like all of a sudden a death which has happened, which can be a car accident, or was it the person was deceased for, or he was having a long term, a chronic disease condition, and that is also some of the thing which will affect his way how he copes up with this grieving. There is also something like, say suppose how much the spiritual support he has from the environment, how much social support he has from the environment. If there is a back-to-back losses in his life, where there are different stresses, it can be a financial stress and it can be a marital stress, and followed by there is a death in the family, then the process of grieving, it further complicates.
I see a lot of patients in my clinic with anxiety, depression, panic disorder, and I can trace the onset of this illness to the loss they suffered in their life, and mostly it is part of uncomplicated or unresolved grief. So could you tell us a little bit about this?
Yeah, so again we have to understand that the grieving can be divided, or it is classified into 2 main categories. One is the normal grief, which we were so far discussing, which is about the following of having those 5 stages, and where the person reaches into a stage of acceptance. But it is not necessary that the person goes through step 1, step 2, step 3. He can be stuck in any of these stages. But the next category of grieving is something called as complicated grief. So when the person is not in a state to go through all these stages, or it is not necessary also that he has to go through, but it's about there is an acute response of death or loss in a person, and is he able to integrate in his life, is he able to take it forward in his life so that it is not disabling his functioning. So if he has reached to that stage, then it is uncomplicated, but if he cannot, then we call it as a complicated grief. So complicated grief is also something like traumatic grief, or we call it as unresolved grief. And again, we can see there are a lot of cognitive, emotional, behavioral symptoms associated with complicated grief, which I think we see a lot of such cases as major depression, we see a lot of cases as panic attack, anxiety, everything in common clinical practice.
Thank you. So, what help is available?
People grieve in different way, and it is important to understand the personal goals associated with the age group they belong to, the intensity, the way how they are tackling their grief. This determines that how we have to help them, which can be a professional help with both the psychologist or the psychiatrist, depending on what symptoms they present with. And as we understand that the complicated grief, it usually resembles something like major depressive disorder, something like severe anxiety attacks, where we all understand that the role of medication is very important, along with psychotherapy, which is specifically directing the grief related issues which the person goes through. We have to see that where the child understands about the concept of grief in order to understand about a child, but adult, we do have grief therapy to help them to resolve this complicated grief.
Thank you. And finally, how the family or friends can support the grieving person?
Yeah, so I have seen that many of the patients who have this loss, or when they go through a complicated grief, they sometimes come for a professional help because they want someone to listen to them. They want someone to be validating their emotions, because as we said that some might not be allowed to express the crying or the mourning phase which they have. They are not allowed to cry during that death period because maybe they are the strongest person, so-called the strongest person in the family. So people don't know, or they don't have the way to express that particular emotion which is related to their feelings towards that dead person or deceased person in their life. So what really happens is, when they can come with irritability, anger. So I think the family should definitely, or if it is a support system, if it is a spiritual support system, people should have an understanding to just not normalize things, but to also have a to validate their emotions, which will be the first step in helping the person who is under grief.
Dr. Lakshmi,
Yeah.
thank you for your time and for being with us.
Thank you so much.